New at 6, a healthcare headache for a local family after getting an unexpected bill for a routine cancer screening.
Yeah, colonoscopies, they're considered really key for early detection, but some Mainers are struggling to get those fully covered.
The I-Team's Dan Lamparella looks into the medical maneuvers leading to confusion and the fight to make screenings more accessible.
I guess you could sum it up under laws and loopholes.
We first met Kimberly Gardner and her husband Delbert at our Ask the I-Team event in Bath last month.
The issue actually concerns some medical care that he received.
Delbert had recently gone in for a colonoscopy recommended by his doctor at Midcoast Hospital, like he has many times before.
They encourage senior citizens to get all the routine preventative screening care, mammograms, colonoscopies. Go do it. It's free, it's screening, it's covered.
But then came a bill for nearly $300.
We did not think that there were going to be any charges at all.
Typically, colonoscopies are scheduled every 10 years, starting at age 45. But for people with a history of polyps like Delbert, more frequent screenings are recommended. And while the Affordable Care Act made preventative care like colonoscopies free, insurers and providers still have some wiggle room when it comes to cost sharing, especially if a polyp is found.
I think it defeats the spirit of the laws that they tried to create.
The Gardners were on a Medicare Advantage plan at the time with WellCare insurance. According to their bill, that plan covered more than $1,300 of the total cost. But because a polyp was found and removed, the remaining costs were shifted to the Gardners, a tactic advocates say happens all too often.
Medicare patients, unfortunately, are still facing this out-of-pocket cost.
Molly McDonnell is the director of advocacy for the organization Fight Colorectal Cancer. She says thanks to a law passed in 2021, those costs are slowly decreasing for people on Medicare.
By 2030, ultimately that cost sharing will go away completely, but in the interim time, each year it's going down by a certain amount.
This year it's down to 15%. And while the Centers for Medicare and Medicaid Services continue to clarify that screening should be fully covered even if a polyp is found, those at higher risk of cancer are still not always protected by the law.
There's sort of this gray area and lag between what insurance regulation says and what coding says, and so it ends up kind of being this ultimately confusing mess for both patients and providers.
WellCare Insurance, nor its parent company, responded to the I-Team's multiple requests for comment. As for Maine Health, which operates Midcoast Hospital, a spokesperson wouldn't comment on the Gardners' specific case, but said they're following guidelines set forth by various federal agencies when it comes to coding for procedures.
And is this really what they wanted? And is this really what they intended?
Do you worry that out-of-pocket cost added on to something like this could lead to people not wanting to get screened?
Absolutely. I think that is a very legitimate barrier.
Barriers patients like the Gardners believe need to be broken down.
When something is bad, you say, well, there ought to be a law against that. And that's what we have our legislators for.
Now, there is some legislation in the works to close up the coverage loophole for Medicare patients. It was introduced by a Congressman, Donald Payne Jr. out of New Jersey, who sadly passed away just yesterday. However, members of Maine's congressional delegation, including Representative Shelley Pingree, as well as Representative Jared Golden, tell us they will support the bill if it comes to the House floor for a vote. For the I-Team, I'm Dan Lamparello. Marissa?
We'll continue to follow it. Dan, thank you.